When a loved one is dying, close relatives have to take on a lot of responsibilities with their care and with helping them make decisions about how their final days can be as comfortable as possible. And to give patients and their carers some space and time during what's a very upsetting and worrying period, Birmingham East and North Primary Care Trust have teamed up with a private provider to offer support at home.
We have a strategy around end-of-life care, and that strategy was about delivering more services along the end-of-life care pathway. Okay. One of the things that was missing from that was access to 24/7 care, and also support for not only the individual but their families. We asked Healthcare at Home to provide what we call the Family Liaison service, and the Family Liaison service provides care for both the individual and their family, and it's provided 24/7 with the support of a care bureau. And the idea is that you take the pressure off the family at a very stressful time.
It's a wide-ranging number of services that we would engage with, depending on what they need. Sometimes it's the little things that are making their lives uncomfortable and not necessarily the disease. But then if the disease is becoming a problem and they have got pain, then we would get the services in for them that are relevant, like clinical nurse specialists, district nurses, and we can get them in a timely manner.
People registered with the Healthcare at Home initiative have access to a 24-hour helpline which can give advice, support and reassurance to the patient as well as their family.
If a patient rings up feeling unwell, distressed, anxious, there will be a nurse available at all times to talk through these symptoms with them with the help of specific based algorithms according to the complaint or condition.
Hello, you're through to the Care Bureau. Ali speaking, how can I help you?
I think the jewel in the crown of the whole scheme is that we have our own rapid response service. So after being triaged by the nurse, we can actually send out a rapid response nurse within a maximum of 2 hours to the patient's own home.
The rapid response service has proved invaluable to the people involved and is reducing the need for patients to be admitted to hospital.
There was one Sunday evening, just after tea, and Jo was struggling to breathe. And no matter how much I tried to calm her down and talk to her, because of her anxiety, it was building up and building up. So I wanted to call an ambulance, and Jo said, "No, I'm not going into hospital again, I'm not going in." So I had a thought, I'll ring Healthcare at Home. And within half an hour, they'd sent a nurse, and she was here for 3 hours, from 7 o'clock till 10 o'clock. She talked to Jill, she examined Jill, she calmed her down and helped her through the evening. And to me, that was an absolute wonderful thing.
We have over 300 patients currently on the service, and we're engaging with lots of other healthcare professionals who are now seeing the benefit of the service, where we can go in and organise some of the support that might not need a clinical expert to organise for the patients.
No, you didn't understand me.
I can hear you fine.
Can you?
Yeah.
The bottom line is the hypothesis is you can increase quality whilst doing things more cost effective. So we need to work with lots of providers who absolutely understand that there isn't going to be any more money in the system, but we need to be more productive, more efficient, more innovative, but we need to increase quality. And that's the challenge.